Good. Kia ora koutou katoa. Welcome to the COVID-19 media update today. Today we have 14 new cases of COVID-19 confirmed by laboratory testing. The locations are Auckland, 5 cases, Northland, 1 case, Canterbury, 1 case, New Plymouth, 2, Waikato, 2, including 1 in Hamilton. We have 1 in Tauranga, 1 in the Coromandel, and 1 in Dunedin. All these cases are in self-isolation, with close contacts being identified, followed up, placed in self-isolation, and then regularly monitored. 11 of these new cases have a history of international travel. 1 is a close contact of a confirmed case, and 2 were at the World Hereford Conference in Queenstown earlier in the month, which had a range of both New Zealand and international delegates. This brings the number of confirmed COVID-19 cases in New Zealand to a total of 67. We have 4 probable cases as well. These are cases that have previously been described, however, even though we thought they were COVID-19, laboratory testing was negative, and we are treating them as probable cases. Just over 1,200 laboratory tests were carried out yesterday around the country, and that brings the total number of tests carried out to date to over 6,000. An update on community transmission. There were 2 cases announced yesterday where community transmission could not be ruled out. Our further investigations of these 2 cases have still not identified a firm link to overseas travel. Just for clarity, community transmission is when we cannot confirm exactly where the infection came from. As we investigate these cases further, including close contact tracing, this increases our understanding of what the infection pathway may have been, and we can then communicate with anyone who was a close or casual contact and ensure that appropriate action is taken. We can also then update local communities about events or situations where contact may have occurred. So in both those cases, that work is ongoing. I understand that people in the areas where those 2 cases live will be concerned about the risk of transmission. So I ask you to just, everybody in those regions, continue with good hygiene practice, physical distancing, and seek advice if you have symptoms. Details for each of the cases mentioned today and the tally of confirmed cases will be on the Ministry of Health website as soon as they are finalised, and not long after this media update. An update on the 2 cruise ships, the Ruby Princess and the Celebrity Solstice, which recently visited New Zealand, and both of which had confirmed cases of COVID-19 which were confirmed subsequent to their departure from New Zealand. We are asking any passengers on those 2 ships who left the ships during their stay in New Zealand to self-isolate for 14 days since they last had contact with other ships' passengers, and of course to be aware of symptoms and seek advice if they do develop symptoms. Details of the movements of both ships can be found on our website. And as mentioned yesterday, we are also in direct contact with the New Zealanders who were on board those vessels. Some are still in Australia and have yet to return to New Zealand. The customs officials have the details of those people, and they will be identified at the border. They will be asked to self-isolate along with every other person entering New Zealand now, and to register with Healthline. Coming back to the Hereford Cattle Conference in Queenstown, our public health team is following up delegates to that conference, which was held from the 9th to the 13th of March, and 4 attendees, including 2 New Zealanders, have tested positive for COVID-19. The other 2 are an Australian and someone from Uruguay. Close contacts of those cases are being asked to self-isolate, and other attendees at the conference are now considered as close contacts in a precautionary way, and they have also been contacted and required to self-isolate for 14 days since they were in contact with people who were at that conference. Southern District Health Board is doing the tracking and tracing work on this with support from the Ministry of Health. Just an update then on the alert level. The alert level remains at level 2. You will note from the presentation the Prime Minister made yesterday that as part of alert level 2, we are asking people with pre-existing conditions such as chronic respiratory disease, which might include severe asthma, bronchiectasis or COPD, chronic obstructive pulmonary disease, and people who are immunocompromised, for example, if they are having cancer treatment, to remain at home. A message to the over 70s. We know many of you are fit and healthy and living active lives, but the older we are, the less our immune system is able to fight off this virus and indeed other infections. And we have seen from overseas that older people are at more risk of serious complications. So we are strongly encouraging you, in fact urging you, to be aware of the need to stay at home and not to have contact with others. So please do heed the advice to stay at home. Ask friends and families, particularly children, not to visit. For the meantime, this may mean talking to your family on Skype or some other method. I'll finish my comments there and welcome any questions.
Can you give us an update? We've heard that there's one critical patient in hospital and ICU. Is that right? And do we have any other critical patients in hospital? No,
there are no patients from the information I have who are in ICU, and in fact I don't think there are any of the new patients who are even in hospital at this point.
And then what about the recovered cases? How many of the cases?
Yes, we're still working on that. That requires us to go back and check with each clinician what the status of those patients are. So we are working on that and we hope to have that information in the next day or two.
What do you say to people who are having trouble getting through to the helpline? They're saying they're being disconnected after waiting for hours on the phone.
So yes, the health line is overloaded. By the way, it's not the only government line that is overloaded. What I would say is to everybody, remember that Healthline is there to give health advice. It is not there to give general advice about COVID-19. It is not there to give information about self-isolation. That is freely available on the COVID-19 website and the Ministry of Health's website. It is not there to just make general inquiries about COVID-19. If people use Healthline as it's intended, which is to ask about symptoms and seek health advice, then we have a sufficient capacity to deal with the load. So just a plea really to everybody to use it for what it's there for. Anyone who needs to self-register can do that online. They don't need to ring Healthline to do that.
We have modelling from a team of university researchers that suggests an ICU capacity overload in New Zealand could mean the difference between a 1 and 2% case fatality rate. Is that what we're looking at?
Yes, well, the modelling is very helpful in that it shows us exactly what would happen if we didn't act quickly and didn't act with great certainty, and that's why we have been. And you've seen the Prime Minister yesterday talk about the alert levels. We're at alert level 2, and the reason that 3 and 4 are there is because we're signalling we may well need to move to those. And the reason we would move to those is to avoid a situation where we overloaded our healthcare system, including our ICU capacity.
We've just reports out of Hamilton that some people are still being declined tests, even if they're displaying symptoms, because the explanation that's been given is that they're being told to not give tests to people unless they've been in contact with one of these cases. Is that the advice they're getting from you, or are they not applying the new standard for testing properly?
So the standard for testing is that the right people get tested. And the case definition is still clear that at the moment people should have a history of overseas travel or an obvious link to that, or a history of being in close contact of a probable or a confirmed or a suspected case, and they should have symptoms. So we shouldn't be at this point, and we can't be testing everybody who has symptoms of an upper respiratory or lower respiratory tract infection. And that is a reasonable thing to do. But as I say, over 1,200 tests yesterday, nearly 6,000 completed. It's important we test the right people, not people who are at low risk. Most of our tests are still coming back negative.
Out of the 14 cases today, you mentioned that 11 had clear links to overseas. What about the other 3?
Yes, so the other 3, 2 are, one is a contact of a confirmed case. So that person was symptomatic and therefore tested and came back positive. And the other 2 were people, New Zealanders, who attended the Hereford cattle conference hadn't been overseas, but there was a meeting at which there were overseas delegates. So we would classify those as having a clear link to overseas travel rather than community transmission.
A retirement home in Auckland has confirmed they have a positive case in their village. How concerned are you about this?
If it's the case that I know about it, I think that was yesterday, and they've put out a media release. This was someone who lives alone in their own place, and so I don't have a particular concern because all the right steps were followed there. Perhaps the last question.
Sorry, lots of universities are being shut down. What's your message to parents in terms of bringing their kids home from university halls and hostels?
Well, I think it's a couple of weeks before the end of the university term anyway, and it may well be that university students want to get home because they'll be working online anyway, so that's an individual choice. Perhaps the last question.
Can I just ask about the long weekend in Otago? Are you concerned about delays to testing there or other sort of issues related to that long weekend in terms of the response down there?
Two comments. First of all, testing continues right through the weekend around the country. Secondly, our laboratory staff are not indefatigable. They need rest as well, and that's again a reason. It's not just the supplies and equipment. We need to make sure that our staff are getting sufficient rest so that they can continue to staff our laboratories, and so that's part of, I'm hoping and expecting that they will be giving staff downtime, but we're not expecting delays in testing results. Thank you very much. I do appreciate your ongoing support and interest.